I'm really pleased to welcome you to today's virtual CommTalks event, Health Communication Challenge, Lessons from Coronavirus. This session is being recorded. Back in March, the WHO dubbed it an infodemic. Early in the pandemic, we were deluged by communications, some reliable, some misinformation, some well-intentioned, but just plain wrong. What have we learned since then in the intervening weeks and months? Our panel today will discuss health communication during the panic through three distinct lenses. First, the efforts of public health professionals to provide accurate, timely, and useful information. Second, how the news media's coverage has shifted over time as we've learned more about coronavirus. And third and not least, the thinking behind the new BU student-to-student campaign called Fuck It Won't Cut It. As is our usual format, I'll first share the bios of our wonderful speakers today. Each person has prepared a presentation or some remarks of about 10 minutes or so. And after we've heard those remarks, I may ask a question or two, and then we'll go as soon as we can to the audience questions. When we do that, please feel free to put your questions in the Q&A, not the chat, which has been disabled. And feel free, by the way, to put in Q&A questions at any time. Now I'm really excited to introduce our speakers. First, I'd like to welcome Leslie Friday, who's Director of Content for Partners in Health, a global health and social justice nonprofit that focuses on providing healthcare to the most vulnerable. She served as a Peace Corps volunteer in Guinea, West Africa, where she taught high school English and HIV/AIDS education. After obtaining her COM master's degree in print journalism with specialization in radio, she worked at weeklies for Gatehouse Media and the Tico Times, an English newspaper based out of San Jose, Costa Rica. She returned to Boston University to work for BU Today and Bostonia magazine before joining Partners in Health as a staff writer and editor in 2015. Welcome to you, Leslie.
Thank you very much.
Thanks for joining. Next, I'd like to introduce Dr. W.H.O, who is Assistant Professor in the Division of Emerging Media Studies at the College of Communication, Boston University. She's also an affiliated faculty member at BU's Department of Computer Science and a founding faculty member at the Faculty of Computing and Data Sciences. She was a journalist and is now conducting research trying to understand how traditional media, such as the New York Times and CNN, and emerging media, such as Facebook and Twitter, influence public opinion. Dr. W.H.O is also one of the pioneering communication scholars who explores big data methods, such as machine learning and crowdsourcing in examining large media data sets. Dr. W.H.O's research has been published widely in leading peer-reviewed journals, and her co-edited book, The Power of Information Networks, which introduces a new theoretical perspective to understand media effects in this emerging media landscape. Welcome, Lei.
Thank you for having me.
Thank you so much. Now I'd like to say hello to Hannah Schweitzer, who's a senior studying advertising with a minor in history here at BU. She's the president of BU's student-run ad agency, AdLab, and has served as AdLab's vice president of strategy and WTBU's PR director. Hannah is a COM ambassador coordinator as well. She enjoys performing with BU's improv comedy troupe, Liquid Fun, and hosting a sex, love, dating talk show on WTBU called Love is on the Air. While interning at various agencies, Hannah has produced work for clients including Burger King, the U.S. Department of Defense, Gorton Seafood, Colonial Williamsburg, Travis Roy Foundation, Rogel Cancer Center, and Improv Boston. Welcome, Hannah.
Thank you so much for having me and for this opportunity.
It's awesome to have you. And hello as well to Emmanuel Reed, who graduated from Boston University's College of Communication with a degree in public relations this past spring. He's from the south side of Chicago, where he's currently been quarantining with his family, but has adopted Boston as his second home and has plans to move back in the fall. Maybe you're actually already here, Emmanuel. As an undergrad, Emmanuel's cultivated community in the Howard Thurman Center for Common Ground as an ambassador and coordinator for Brothers United, BU's only group for Black men, and as a communications coordinator for his fraternity, Alpha Phi Alpha Fraternity Incorporated. He's also served as a Scarlet Speaker in the Office of Admissions. And upon being approached for the opportunity to join the team that will help serve BU's reopening efforts, he jumped on it with the chance to work with a team of driven, creative students that have produced amazing work. Emmanuel currently works full-time as an apprentice for Prosec Partners, a financial communication firm in Boston. Welcome, Emmanuel. Great to have you.
Pleasure to be here. Thank you so much.
Yeah, thanks a million. So now I'd love to go to our presentations, after which we'll have our Q&A. And again, feel free, please, in the bottom of the box there's a Q&A box to put questions in whenever you have them. Over to you, Leslie.
Great, thank you for the lovely introduction, and it's a pleasure to be here among BU Terriers again. I am going to attempt to share my screen, and hopefully you all will be able to see what I'm seeing here. All right.
Looks good so far.
Good, all right, thank you for the thumbs up there. Technology is not my forte. So lessons from COVID-19, a view from Partners in Health. And if there's any way that you guys can advise me on seeing this in any better way, let me know. But I'll just run us through this here. So I started at Partners in Health about 5.5 years ago, and I started as a writer and editor. It's been a pleasure to be part of the team. But, you know, who knew that, you know, in January, in February and March, we would be looking at the year that we're looking at now. So back in March 18th, we all said to each other, you know, this thing, COVID, we're gonna go home for a couple weeks, reassess, and we'll all see you back in a bit, and we'll start up this work in real time, in person. Yeah, right, is I guess what I would say, because here we are now in the midst of September already, and probably won't be back to that office space in Boston until January. So how do you run communications in a virtual environment when we've never done that before? And we have 11 countries we work with, colleagues all over the world, and an expanding team, frankly, in Massachusetts and all around the United States. So that was the big challenge. How do we effectively communicate at this time? So I'm going to take you through 5 separate challenges in the way in which we addressed it as a healthcare nonprofit that focuses on making sure that everyone has access to healthcare. So one of the challenges was we had very few visuals. How do you tell stories with only words? And I'm a word person, so I value words, but they only go so far. So one of the challenges was we had everyone in lockdown, everyone in our Boston-based office, and everyone globally was told to shelter in place, right? So we don't have photographers out there taking images of the work that we're doing, nor video. There was also a lot of stigma about being photographed, whether you were a patient who was diagnosed with COVID or you're an individual caring for those who are sick. So many of our staff members and our clinicians were very hesitant to have their face and name shared because in some places there was violent reaction to them being identified or people being rejected from their communities because they had contact with COVID patients. So that was another aspect. How are we going to deal with that in a very rapid changing environment where we couldn't just stop telling stories about our work? So we switched to more graphic treatment, and the slide that you see here is an example of that, you know, using our graphic design and artistry to really think about creative ways that we could represent our work because we couldn't take photos or videos. We also relied on our coworkers to take selfie videos of themselves wherever they were, in whatever situation they were, and the standards for imagery and videography had to lower in some sense, but I think it was more reality-based, right? This is what you're dealing with in the middle of a pandemic. So I think people were more forgiving because of that. So those are some of the ways that we dealt with having few visual storytelling means. The second challenge was just a lack of information. This was a completely new disease to humans. So there was no research, there was very little information about this. People were scrambling to get the latest information, including our public health professionals who have worked in infectious disease for decades. So based on that, you know, how do we effectively prevent people from getting sick and treat those who are ill? That void began to fill, unfortunately, as people shared inaccurate information or blatant disinformation, right? So how do we get at playing in a service role and providing basically what is a PSA for a broad group of people, a general audience, not educated about infection curves or herd immunity or any of the terms that public health professionals might take for granted? How do we effectively communicate to people that message? So we produced PSAs of sorts that were graphics. They were also shareable on social media. We had a video which we called Contact Tracing Explained. And it was actually a product that we had during the time of Ebola in West Africa when we were responding to that pandemic, or excuse me, that epidemic, that outbreak, but reworked it because contact tracing, at least in Massachusetts, when we produced this piece, is all being done virtually. No one is going door to door to figure out who has been infected or exposed to this particular disease. I would play this, but for the sake of time, I want to keep going. But if you do go to Partners in Health, our YouTube channel, you'll be able to find this video as well as a number of other pieces that we put out. The third challenge is just changing national guidelines, right? So this was, again, new. The science around COVID-19 was evolving, and even national guidelines shifted over short periods of time. So the people that we typically go to fact check, our clinicians, our public health professionals, epidemiologists, are kind of scrambling to find the latest from the CDC and National Institutes of Health to figure out what is the most accurate information we can provide people. One example of a Mythbuster series we put out, we did one on COVID in general, and then another about contact tracing. This series, we had to go back to multiple times to make sure, right up to publication of this on social media and on our blog, that we had the most accurate information. And as you'll see now, our example of face mask use recommendations for the public, at that time when we were talking about this, everyone said save face masks for clinicians, for health professionals. Well, as we all know, that has drastically changed, and face masks are definitely a public health recommendation for everyone, regardless of whether or not you are a healthcare professional. So our nursing colleagues and infectious disease specialists were the ones to help us get the most accurate information. And this graphic, although produced, was pulled from the lineup before we went live so that we were not spreading false information, and we were following national guidelines as well. The fourth challenge, there's few voices of authority, right? In the past, in other outbreaks, I think people reliably would go to the CDC, the Centers for Disease Control and Prevention, and the head, the figure who would be leading us through any type of outbreak would provide us with that type of guidance. But with the exception of maybe Dr. Tony Fauci, I don't think there is much national leadership on what we all should be doing in a consistent basis. So in that gap, PIH leaders have served as, among many others, we are definitely not the only, but PIH leaders have served as a go-to public health resource for broadcast and print media. And you know, we used to celebrate a story that got into any major public broadcast or print outlet, and our hits in the press became so fast and furious that it was a bit head spinning for a while, just up to August 1st. So starting roughly Marchish to August 1st, we had 413 press placements, 4 times the volume of an entire year in that short span of time, and 3.8 billion impressions. across places like NPR, the New Yorker, CNN, the New York Times. So our folks were really the go-to experts to comment on the global pandemic and the response in the United States. And then the last challenge that I'll talk about is, you know, as a nonprofit, you have to sing for your supper. So part of communicating is convincing people not only to believe in the mission, as advocacy journalism, I guess you might spin it as, but also to believe and care enough to donate, to support the cause. So a lot of our donor events used to be in person, and jumping in with the fray, we decided we can't have these in-person events, we should switch to webinars. So that was a means for us to fill the gap and really be in touch with people who are our supporters. So in tandem with our development department, marketing and communications produced a series of seven webinars based on a series of public health topics. And I was the moderator in those webinars with our PIH experts, the first of which was the mental health in the time of COVID, which really received a lot of viewership and was shared quite a bit, I think, because it directly talked about the worries and the mental health angle of this situation, the mental and emotional toll that this pandemic has taken on all of us. So, and those have been successful. We're actually going to have another series in the fall to continue to reach out to donors and communicate with them, even though we can't be in person. So key takeaways, I would say, you know, be nimble and patient, get creative. If one thing didn't work, you got to find the next thing. And I think our team is quite good at throwing spaghetti at the wall and seeing what sticks, and being critical of ourselves in a good and professional way to try to get the best solution to the problem. Teamwork is the dream work. As cheesy as that sounds, I think if you have the right people in the right positions, you really can achieve quite a bit, even though resources are limited. We maintain open channels of communication, maybe too many, Slack, Teams, WhatsApp, Skype, you name it, we were on it, and email too, by the way. So it's just a constant means of touching base. Normally you could just reach over to your colleague sitting next to you, but now your colleague lives in another city or country, and you just need to have that open line of communication. We love our fact checkers and editors, and you know, that's not like a normal newsroom, but they are our doctors and nursing friends and our public health professionals who keep us honest. And you know, we edit ourselves and our own quality check, quality assurance. And then just don't be afraid to try something new. I think that was one thing that, you know, we really didn't know what we were going to do when we all left back in March. How are we going to maintain this well-oiled machine, or mostly well-oiled? And I think, you know, by not being afraid to try things that we've never done before and then improving the process over time, it's really served us quite well. So that's all for me, and I look forward to the discussion later here. But if you are interested and want to find out more about the work that we do, please do check out our website. And I'll stop sharing my screen now.
Thanks, Leslie. That was great. And also, I especially like the advice about being nimble. I think we're seeing that over and over again in everybody's response to the situation through the pandemic. So yeah, can't wait to hear the rest. And thanks very much, Leslie. That was super. Lei, can we turn it over to you?
Yes, let me share my screen. Can you see it all right?
Looks good. Thank you.
Thank you very much for inviting me to speak at this panel. I was a journalist and now a media scholar. And I've done a lot of research about media effects during the past few years. And we know that news media are very powerful. They have the power to tell us what to think, how to think, and even what to do. And as for today's theme, the news media, we believe, should also play an important role in communicating the COVID-19 pandemic to the public. So what I would like to share with you today is an ongoing project that my research team has been doing since early this year. So we have looked at how news media in different parts of the world cover COVID-19 and how it is potentially related to the real world numbers. So I would like to give a shout out to my research team behind this project, AIEN, Artificial Intelligence and Emerging Media. So we are a group of communication scholars and computer scientists, and we have been using the so-called big data computational methods to answer communication-related questions. So as you can see from the right image, like many other research groups, we have been meeting online during the past few months. To start off, I would like to briefly explain a concept key to our project, media framing. So we know that it is journalists' responsibility to report reality, but in practice, they select parts of the reality and promote them among the audiences. And in communication research, we call this media framing. So looking at this image, if the news media focus on the left part of the image, the audience would see the cruelty of the soldier, right? So if we look at if they focus on the right part of the image, then the message will be very different. And of course, this entire image is an outcome of media framing because we don't know what's happening outside of this image. So speak of COVID-19, we know it is a health issue, but it can also be a political issue, an economic issue, or a societal issue in news media's framing. So let me just give you some examples. So you probably have seen stories like these, which place the blame on certain countries or certain groups of people, and this is media framing. And as a result, we've seen xenophobia and racism related to COVID-19 all over the country. And of course, media framing not just happens here in the United States, it happens everywhere. So our goal of this project is to look at what aspects of the pandemic have been emphasized on different countries' media agendas over time. And given that there's a huge amount of news data about COVID-19 produced every day, we use a combination of both traditional communication research methods, manual content analysis, and a computational methods such as machine learning and topic modeling to analyze the news data. So currently we have included 9 countries or regions into our map, and we will include more. For each country or region, we analyze the main topics about COVID-19, such as health, politics, and education that news media have emphasized each week and try to correlate the media topics with COVID-19 statistics. And I want to show you our website. So we have created a website to present our results. So you can see the information about our project, our research method, and you can also see the results for each country or region. So for example, United States. So we started early this year, starting from January. So we looked at each week on what topics news media have focused on. So for example, did they talk about the government responses, domestic outbreak, or domestic economic consequences? So we trace the change of topics over time. And then we also put the media topics and then the COVID-19 numbers side by side. So here the black line represents the cumulative COVID-19 cases by week. So we can see how the topics shift as the number shifts. So here is a graph, so same media topics graph, and this black line represents the new COVID-19 cases by week. So the pandemic is not over, so our analysis is also ongoing, and we have tried our best to update the results, the media topics, the numbers on a regular basis. Okay, so back to the presentation. So in the interest of time, I'll just briefly talk about what we have found about the news coverage in 2 countries, China and the US. So here, this figure represents the results of Chinese news coverage. So different colors represent different media topics. And again, the black line represents the new COVID-19 cases by week. So from this graph, we can see that the situation has been in control in China after mid-March. So we can see the peak here in mid-March, and nowadays we don't have there are not too many cases in China right now. And you can see that government responses, the bluish topic, and then the domestic economy are the two things the Chinese media have focused on over time. And then the pattern continues today. And let's look at the US graph together. So it is clear that before mid-March, all the news coverage was focused on what happened in China, right? So the reddish topics, the outbreak in mainland China and the global economy. And after mid-March, when things became out of control here, then the news media start to pay attention to the domestic outbreak, the domestic economy, and some other things. So there are a few interesting patterns that I want to share, but I will, again, in the interest of time, I want to talk about two. So compared to the Chinese news media, the US media definitely paid more attention to personal preventive actions, such as wearing masks. Should we keep social distancing? Should we stay at home? So if we revisit, so this is not something that the Chinese media talk about a lot. People just do it. But here in the United States, it has been a controversial topic since early on this year, right? And the people still, and the news media still talk about it today. So I guess the difference might be due to the cultural and the political differences, because American culture values individual freedom, and here there's a decentralized government. So that makes everything very controversial here. You can see that the media, news media still talk about personal preventive action, whether we should wear masks even today. And the second, if you look at the Chinese news coverage again during the very worst time, the news media only focused on a few things: government responses, domestic economy, healthcare, right? But if you look at the US news coverage, it is way more diverse. So the news media talk a lot about a lot of different things. So let me give you an example. So if you look at the data that we have at the end of May and early June, it seems the situation became a little better here, right? So the number decreased a little bit. But then at this time, the news media start to talk about a lot of different topics. So for example, the purplish topic, that's how the pandemic affects the local politics. So that's the 2020 election. And how the pandemic affects the entertainment and the sports industry. And of course, there was a lot of news coverage about race issues, race relations issue. So as the media talk a lot more about different topics, maybe there's something to do with the media coverage, then the number of cases climbed again. So we will run more stats to see the correlation between the media coverage and also the real world numbers. But here from this graph, we can already see some interesting patterns and interaction. So to sum up, we see that the news media in different countries and regions, they communicate the pandemic to their different audiences very differently, which may speak to the different situation each country is facing now. And I'll stop here in the interest of time if you would like to learn more about our project. So I would like to invite you to visit our website. Thank you.
Lei, can you leave that up for just a second? Because there is actually a question in the Q&A about the website. So just so
Okay.
you can see that address, covid19.filemerge.com.
Philosophy Emerge, philemerge.com.
Phil Emerge. Thank you. And just a reminder to folks, do feel free to throw additional Q&As in there when you get a chance. Thanks a million, Leah. I think it's safe now to stop sharing, and then we'll hear from Hannah and Emmanuel.
Awesome, thank you.
Thank you. Over to you.
All right, can everyone see that? Cool.
Looks
Hello, I'm Hannah. I am a student at COM right now. I am a senior and I'm here with Emmanuel, and we are presenting a completely student-run COVID-19 campaign set out to educate and motivate students about COVID-19 protocols on campus. So today you're going to meet the team behind the campaign. We're going to talk a little bit about the strategy, show you the fun stuff, show you the campaign, why we think this campaign works, and then reactions toward the campaign since we've been out for about 4 weeks. So the team. We are a mixture of Ad Lab and PR Lab, and we are two student-run agencies outside of the College of Communications, and we usually don't work together, so this was an awesome opportunity for us to combine to create this campaign. As you can see, I'm here as the project manager and strategist, and you can see Emmanuel here as well as a public relations manager. So the challenge we set out for this campaign is that we want to educate and motivate undergraduate students. The thing is we know many Gen Z people know what COVID-19 is. They are educated in it. They're smart individuals. The problem is that when you come back to campus, it might feel like a return to normalcy. And we want to remind students that COVID-19 is still happening and still important. And that if we want to stay on campus with the people we love and the place we love, we have to be mindful and think about others. We also really want our campaign to be entertaining and engaging. We see this a lot with Gen Zers. They love to reshare things on social media that they believe in so that their peers believe in it as well. So we want that to happen with our campaign. We want someone to see it on Instagram and think, this needs to be in my story because I believe it, and I think all my friends need to hear this. So before we created the campaign, we really wanted to think, what are BU students thinking about COVID-19 and campus? And so we did a focus group. We did 3 focus groups under 1 week. It was a 1-week turnaround, and we talked to 10 students. And as you can see, the students really showed the BU community. We had different races, genders, hometowns, classes, schools, and ages. And we learned that 80% of the students in the focus group are really excited to come back to campus. They're excited to leave home. I love this quote from Dominique. She says, anything to get out of Texas is kind of nice. They're excited to see their friends. They miss them. And most importantly, they're excited for the campus atmosphere. For many students, BU is a place where they feel physically and mentally safe. It's a place where they can feel like they can be themselves. And so they don't want to leave. But while they're really excited to be back, they said, well, I've got some points of concern. A very popular point of concern is, I think my peers aren't going to follow the rules. That maybe it's wishful thinking to think that everyone will take this as seriously as I do. They're also afraid of being kicked off campus abruptly. Last spring was definitely something no one really expected, so they just don't want that to happen again. And so we're here to remind students that if we follow the protocols, that won't happen again. We were curious where this campaign should come from. What's the voice? And we learned that 70% of students don't look to BU as an institution for advice, but they look to the people at BU. They look to the students, the professors, the mentors. And that's the whole point of a student-run campaign. We are talking like you would talk to a friend. We provide advice that's trustworthy because we're at the same playing level. We're also curious about the tone that we should have in this campaign. And 60% of those in the focus group said they want an aggressive approach. They want BU to make it clear, and those talking about COVID-19 protocols to make it clear that these protocols aren't an option. They're something everyone needs to do for the better of the BU community. So that brings us to our campaign. The insight behind this campaign is we've seen this in the news, and we noticed that so many Gen Zers are cutting themselves slack for breaking the small rules. And this is something that happened all the time beforehand, before COVID-19. A college student would go, should I study for my exam? Fuck it, you know what? I am tired, I'm just gonna go to bed and I'm gonna wake up early and I'll get it done, which I have tried and it doesn't work. And they're saying it with COVID-19 protocols as well. Should I have a small gathering with close friends, no masks? Yeah, you know what? Fuck it. They're my friends. They would never have COVID-19. And so we're here to remind them that saying fuck it this year definitely isn't going to cut it. So that's the fuck it, won't cut it campaign. We're calling our fellow students out on their bullshit and reminding them that saying fuck it to the small rules can actually lead towards really big consequences. So here's some places you might see our campaign. This is our manifesto behind the campaign. A little bit about it. Rowdy parties, all-nighters, and hanging with friends 24/7. That's college. We aren't losing it, we're just pressing pause. we can't miss another semester, and we can't take another Zoom class, and we certainly can't spend more time in our high school bedrooms. That sucked, right? It's on us. Carelessness will put us back to square one. So where will you see this? One place you'll see it is in the social atmosphere, and this is kind of where we're taking over the campaign, just because this is a lot of where students go for information and to hear from friends. We are found on Instagram, Twitter, and TikTok, and Instagram is our main platform, since that is a platform many young people use to share their opinions. We started off with this launch post. It's just a simple post that says, "Let's stay on campus this semester, please." And it kind of blew up. We had 545 sent or reshared from the post, and also around 15,000 accounts reached out of this post before any payment. One part of our Instagram and our social media behind this campaign is infographics, and this is my favorite part of the campaign. We are not only here to finger wag, but we're also just giving tips and tricks about things that BU might not give tips and tricks about. So this one here is an infographic focusing on how to have sex during COVID-19 in a safer way. We also did an infographic on how to actually hang out with your friends. We want to discourage students from going out to party, but there are ways you can see your friends in a safe way, whether it's outside in a small group, keeping your distance, talking to your friends about their last test, and making sure that everyone is comfortable before they all see each other. We also have BS meters on our Instagram stories. So here we say something that a student might believe, and we call them out on their BS and give them the real facts. One very common myth around COVID-19 is, "I'm young, so nothing bad will happen to me." And we're hearing a lot of students say that on campus. So we're reminding students that that might not be true, and sometimes you forget that actually it's not all young people on campus. We are also out of home a bit, and here we have more of a guerrilla style of marketing. So we have students running around and putting up all this stuff. We actually put up these stickers ourselves as the team. I think I put up that elevator one. So these are elevator and bathroom stickers that just remind students to take safe precautions in a fun way. We are also on Warren Towers. Here we just have some posters, remind students about protocols and how to take care of themselves during this time period. And my favorite part is that we worked with a local BU student artist to paint the rock. This happened this weekend, so you have to check out the rock if you're on campus. It is decorated in Fuck It Won't Cut It stuff and reminds students to keep a distance and wear their masks even while on the BU beach. We also have 50 brand ambassadors. So these are students who are really involved with the campaign and sharing the campaign message out of social media and out of our out-of-home placements. One thing they do is create TikToks. Here's one example. So that's one TikTok created by a student named Evan, who is a brand ambassador. And they also pass out swag. So we have t-shirts, cups, bottle openers that are also utility keys and stickers. So they're out there reminding students to wear their masks, keep their distance, and rewarding those who are doing that with fun swag. So I'm now going to pass this off to Emmanuel, and he's going to talk a little bit about why the campaign works.
Thank you so much, Hannah. And hopefully, as you have seen already for the presentation, the Fuck It Won't Cut It campaign is not just to be quirky just for the sake of, oh, this is shock value coming from BU. As you can see on the next slide, we really wanted to make sure that the messaging we had really was edgy with a purpose. And so the real intention drove our communication strategies from the beginning. From the genesis of the group coming together, we knew that Gen Z didn't really have a lot of trust in the people in the positions of power, right? We'd already seen Washington University receive some criticism from students on social media earlier in that summer related to some of the current events that had happened in the country. So there was already this debate of how are we going to communicate a vital message and communicate and advocate for healthy behaviors and potentially change attitudes in a way that's going to make sure that it's coming from students and it's going to go to students. And so we understood, Hannah, if you go to the next slide, that we wanted to come off as relatable as possible. And again, in talking with people, as you've heard, in the focus groups, that there was a strong desire for authenticity. At this point, the COVID-19 pandemic has already been very raw. And so we wanted to use language that was not only relatable, but that was cut dry and to the point. And so that was part of the reason why we thought Fuck It, Won't Cut It would be so applicable, not only for its initial shock value, but because it works. We also did research and saw other opportunities in campaigns such as the Fuck Cancer campaign that really made sure that there was academic language that was there. And once we thought about it, it really wasn't the academic language we thought. Again, we wanted to get to the point, and we wanted to make sure that students were able to digest small amounts of information that had large quantifiable results. And so that's why, again, the campaign really felt like we were coming from a place of genuine care and authenticity as peers. I mean, although I've since graduated, unfortunately, we still wanted to come as a collective unit, as a group of students, as a group of undergraduates communicating to our colleagues. But of course, it's more than a campaign, right? If you look at Nike, Just Do It, or if you look at other campaigns that have short, quirky messages, it's more than just the actual message. It's actually, what are they communicating about that particular brand? And so when we came up with the idea, we wanted Fuck It, Won't Cut It to not just be thought about as this particular campaign idea, but we wanted to influence and change behaviors. In essence, we wanted to adapt a new mindset on campus that would be pivotal to making sure that the university could not only reopen safely, but also to stay and remain open. We've already seen, unfortunately, in the news that there have been other events and negative consequences for students ignoring new policies and choosing to act in certain ways that are possibly detrimental on a public health level. And so therefore, we wanted to make sure that it wasn't just something that you saw on Instagram that you were scrolling, or you possibly saw in an out-of-home advertisement. We wanted this to really represent a new mindset that would not only make BU safer, but would also make the students that interact with BU, even in the larger community, safer. So therefore, going for a mindset idea. And again, as Hannah said, we didn't want to come off as this authoritative figure that's finger waving or condemning people for their behaviors, because as Hannah said, we recognize that students are trying to get back to college. My younger sister just a moment ago was on her Zoom class, and I just felt so bad because I was like, you know, here you are in Chicago and she goes to school in Connecticut, and I just felt bad that she didn't have the experiences that are unique to an in-person college experience. So because we gave advice in relatable and friendly language, we really wanted to connect to students in a way that made them feel that we actually care about them. And of course, as we saw with these other extensions, that language is coupled and paired with other extensions that really bring this campaign to life for somebody who's physically on the BU campus. And so additionally too, it's more of a movement. It's not just, it's not just us kind of being fun and creative on campus, but as we'll see in a moment, this is something that the entire world is watching, right? Our demographic and students who are in this key area have a lot of attention on them. And especially with the reopening campaign, it's like the pandemic is getting another layer. So we wanted to make sure that a movement really was started. And this was a way to show the world that Gen Zers know what's really going on. We are comfortable making sacrifices, we are disciplined, and we have the long-term reach to stay on the campus we love with the people we love. And so as you see here, it's people, and that's as simple as people, you know, sporting our swag and making sure that they believe in the vision. And so moving into reactions, we were able to see that we were able to garner over 3,000 followers in less than 2 weeks, incorporating over 50 brand ambassadors and 20 plus direct messages to our social media channels for people inquiring to get involved with the actual campaign. So as soon as we launched, there was there was great traction from the students, from our target audience. And as you see here, we have garnered press from both a regional perspective as well as a national. So we have news ranging from Fox News to Politico, and then we also have more on a regional level featuring the Fuck It, Won't Cut It campaign in the Boston Business Journal, as well as the Boston Globe, and of course, the Boston University's BU Today publication services. Now, for negative reactions, most of them came from students who were not just, they came from people who were not undergraduate students at BU, nor undergraduates in general. So these were people who, you know, were just hating on the campaign just because. And again, if you can't please everybody, and if you are, you're doing something wrong. So we were actually glad to take this criticism to fine tune the campaign, but also understand that this is what it is. So some people thought it was, you know, a PR stunt from the university to garner more reactions. Some people didn't think the slogan would make things safer. They thought it was just somewhat of a flex that, oh, we can file for a trademark, for example, using kind of hard language. And some people thought that the campaign should be a little bit more serious and encourage people to actually take away some of the key things that make college college. But on the flip side, we did receive an overwhelmingly amount of positive reactions, again, from our target audience. So some people were honest in saying that they were a little confused from the university's macro level communications about what the university was doing to tackle COVID-19 for the reopening. So a lot of students really did appreciate that there was easy and digestible information on something as accessible as an Instagram page that's already in their feed, that fits in with their algorithm, and that helps them to be more informed on campus. Some people were worried about their peers, and therefore we're able to point people to our resources, our website, or our Instagram, or our swag. And so they were really connecting to our extensions. And people just thought, again, it was fun and relatable. Going back to the language thing, we're talking in a way where we know we're not going to be talking from some sort of displaced position. We want to be coming off as if we are not necessarily holding your hand, but right alongside our other students as we're maneuvering the streets of Boston. So all in all, overwhelmingly positive reactions we received. And so again, we wanted to make sure that we communicate, again, in addition to being thankful for the opportunity to speak today, that we want this campaign not to just keep Boston safe, but also to keep all students all over the country and all over the world safe. As the country is starting to reopen, and as Boston University has already commenced classes again, we are seeing that this campaign is getting really solid results, and it's helping students feel safer and make smart decisions. And so, as Hannah said, you know, it's not about just fuck it, won't cut it at BU, but it's about how can we make sure that we remain as safe as possible on the campus we love with the people we love. So thank you.
Thanks, Emmanuel and Hannah. That was amazing. Great presentation. There's actually been a lot of love in the Q&A to you all, just saying congrats and sharing compliments. We do have some questions rolling into the Q&A, and I want to ask as many of them as we can. But before I do that, I want to take the moderator's privilege of asking just one follow-up for a couple of the speakers. And first, I'd like to direct this to Leslie. One of the things that was really striking about what we've seen, and I'm sure W.H.O's research is also looked at, is the tremendous amount, perhaps more than ever, I don't know if that's fair to say, of misinformation. So much so that I'm seeing a lot of coverage now of, from various media outlets about physicians wrestling with false information they've gotten off the internet and trying to grapple with that. So one quick follow-up I had to your great presentation, Leslie, is, what are we doing to try to counter that from health providers' perspective? And is there anything that we all, who are watching and listening here can do as well to help?
Yeah, that's a good question. I think what's really kind of alarming in general at this moment is that there's a question on facts. There's a real attack on facts and reality and science. And I think that's what's truly disturbing, right? Is that in such a short period of time, people can question that there's objective reality. And I think, what we just continue to look for is what is the science behind all of this? What can we share and repeat? And I think, it's not a matter of, well, we already said that. I think we need to keep repeating the same message and make sure that it's hammered into people's heads. And I think, it's interesting because there is, as Dr. W.H.O's research shows, it's a bit cultural, right? It's politics, it's economics, it's culture. So where are you and who's your audience? Who are you talking to? So you really have to be able to package the message in a way that people will understand it. So I think what our doctors and what our public health professionals are trying to do is just find the most accurate information, keep repeating it, and putting it in a way that is where people are. So social media, if it's on broadcast media, if it's in print, just sharing information with your friends. I think any way that people are going to find it where they're at. I love this Fuck It Won't Cut It campaign. I think it's fantastic. And I can't wait to hear more about it. I know there's many questions. So I hope that helped clarify things.
Yeah, thanks a million, Leslie. And so the kind of another pressing issue that has been shaping media. So this is for you, Lei. And I don't know how much your experience personally as a journalist and following the industry might enable you to comment, but at the very time when information, so floods of misinformation coming out, we all know that the news industry has been suffering from, economic trauma, I want to call it, and that's only been, if anything, accelerated by COVID. We've been seeing lots of additional layoffs and so on. Can you say, if you can, and maybe it's an unfair question, how much that may be influencing the coverage trends that you're seeing?
You mean misinformation in terms of COVID-19 or in general, the media?
Well, specifically, I'm thinking the news media's ability to, the types of stories that we're seeing come out of the news media, how much are they shaped by the fact that the media outlets have reduced numbers of people being able to put out that content, reduced numbers of scientifically trained journalists. That sort of thing.
So one point that I want to make, this is also based on my previous research. So repetition definitely has a power, right? So sometimes the news media try to report on rumors, report on fake stories. So they feel like they are going to fact check it. They feel like they want to tell people, oh, this rumor is not correct. This is a fake news story. But the fact that they repeat the rumors, the fact that they repeat the fake stories, make the message, make the information salient on the public's mind. And then, nowadays we have social media and people try to get something from the mainstream media, right? And then sometimes maybe they just miss the part of fact checking. Then the misinformation, the rumor is repeated again and again, and that becomes something that people remember in their mind. So like right now, we still have 24 hours a day, right? So people's audience attention is a bit limited. So if everything that we focus on, we highlight on the media agenda are the rumors, are the fake stories, no matter you are reporting on it or against it or fact check it, there's something that we remember, and that has an effect. And then the people will be too busy with following these fake stories while ignoring more important things. So that's something that we found over the years based on my fake news research. And it's happening both here and in other countries.
Yeah, thank you so much. So some things I've heard people advise are check it before you share it on social. Don't just like share the headline, make sure it's actually worth sharing. And also don't repeat the lie if you're debunking something. Just a little tip from me to you. So let's turn to Emmanuel's and Hannah's great presentation. There are a lot of questions in the chat about behavioral change and what we may have seen. What are you doing to track that? And tell us how that's going.
Yeah, so I can start here. So the campaign has only been out and on campus pretty much for only 4 weeks. So we have not begun yet to track things, but what we have begun to track is how we are doing on social media. And we've noticed that we are continually growing, and we pretty much spiked right when campus opened up and students were moving back in. But in the future, we will be tracking that by working with SHS and seeing how protocols are going, working with the Dean of Students to see what problems are arising, and we will continue to tailor our campaign based off what's happening. One thing I love is that these brand ambassadors are the eyes and ears. We have different teams of brand ambassadors, one being college, student, and social life ambassadors who are keeping an eye out and talking to their friends and working with Dean of Students to see what problems are arising that students are confused about? Are students actually going to parties, or is the problem that so many students are having small interactions without masks that could end up piling up, if that makes sense? Another one is we have an off-campus team, and so they are the eyes and ears of what's happening off campus. Same thing there. Are we getting what concerns we might have and what mistakes might pop up correctly, or do we need to be covering other things? So we'll be working with all those offices at BU to get stats and better understand to tailor our campaign, and then working with the students and working with our social media insights to see what is working, what are people engaging with, what questions are we continually getting, so we can make sure our campaign is to the point of what students need right now.
I also see questions around two other areas that I'd like you both to address as you see fit. You know, what did you consult with behavioral health and other specialists informing it, and what can we expect to see for the rest of the semester?
Yeah, we are so lucky to work with all the amazing resources that BU has. We have been working with behavioral health and SHS for all posts that are focused around that stuff. All sex positive, sex ed posts, we get checked with behavioral health to make sure that we are giving safe sex tips that are reasonable, that are understandable and real, and also inclusive. And same with the Dean of Students office to make sure all our posts are inclusive to the BU community, and not just something we might believe, but that everyone would understand. So yes, we are working with all the resources we have on campus to make sure we are not spreading any misinformation.
Yeah, awesome. Emmanuel, did you want to add anything? I'm sorry if I talked over you.
No, I think Hannah covered a large majority of it. The only thing I'll add is I think it's also been interesting too to see the reach of social media as well. So sometimes we'll be posting and the insights will share with us how people are responding to our direct messages and saying, hey, we thought this was really interesting. Sometimes that will turn into a couple of partnerships. So the latter half of your question too, and Hannah can talk more as she's on the ground in terms of what can we expect. There are different people trying to partner with us in the Boston area, or maybe not necessarily partner, but are concerned about making sure that there's communication between other health professionals in the Boston area to make sure that we're spreading as accurate information as possible.
Awesome, thank you. So we have 2 minutes left, but I think we can maybe jam in one more, why not? This question is for Leslie. You mentioned quality checking and getting good information. How would you categorize the flow of information when you have internal access to experts and are a nonprofit? Do you think it's easier to make those checks and get quality information in comparison to, say, mainstream media?
Yeah, that's a really good question, right? I think, you know, one interesting thing about working in communications in a global health organization is you have access to some of the brightest minds, right? And a lot of our folks are affiliated with Harvard and really premier institutions. So they're the top of their game. They're also, though, literally helping people save lives. So that work is very important to be done, you know, across 11 countries and then consulting with our partners in the United States. So they're busy actually doing the work of fighting this pandemic. And sometimes it's hard to grab the attention of people and grab that information. But I think, you know, we are lucky because we have that inside take. And if we have an inkling about an idea or, you know, just really want to play with a concept creatively, we always go to them to see, you know, is this going to make sense? Does this fly scientifically? You know, what would you recommend as an approach? So we are lucky in that sense. And I think we also are trying to be mindful that their job in literally fighting the pandemic on a day-to-day basis is quite important. So we want to play second fiddle when it makes sense.
I've muted myself. There you have it, folks, a fascinating set of observations on the coronavirus pandemic as a communication challenge through three very distinct and fascinating lenses. I really want to hope you will join me in thanking our wonderful speakers for really insightful comments and remarks today. I learned a lot. I've seen a lot of love in the Q&A at you all, and I share it as well. I also want to say for folks who have remaining questions, for instance, I've seen a couple about collaborations and so on. If we didn't get to answer your question on air, you can drop a note to comdean@bu.edu and we'll try to get you an answer, if you want to connect with anybody or like that. And the last thing I want to say about that is this session has been recorded. It will be housed on the www.bu.edu/com website. So it'll be on the COM website. We house them all on a single page. If you have to struggle again to find it, let me know, and we, at comdean at bu.edu, and we can help you find it. But all of these and a lot of other lovely conversations are archived there. And look forward to seeing you at the next one of our series. And thanks again so much to fantastic speakers today. Have a great afternoon.
Thank you.